Hemodynamics and Circulatory Shock by Nicholas Riesenberg. All right, so we're just going to give a quick overview of shock first and the different types. So shock is a life-threatening condition that occurs when the body is not getting enough blood flow. Lack of blood flow means the cells and organs do not get enough oxygen and nutrients to function properly. Many organs can be damaged as a result. Shock requires immediate intervention and can get worse rapidly. As many as 1 in 5 people will die from shock. So the different types of circulatory shock, you have hypovolemic, distributive, cardiogenic, and obstructive. So with hypovolemic shock, it's a medical or surgical condition that you have a rapid fluid loss, which causes multiple organ failure due to the lack of adequate circulation, circulating volume, and inadequate perfusion. Hypovolemic shock can occur from either external or internal blood loss, or just fluid loss as well. So types of external blood loss, penetrating trauma, so car accident, stab wound, gunshot wound, anything that's going to penetrate the skin and cause a lot of excessive bleeding, and then severe gastrointestinal bleeding. And then types of internal from blood loss would be a solid organ injury and abdominal aortic aneurysm. So things that are going wrong with the heart, definitely, but just blood pooling inside the body from an organ not working properly or being damaged. And then conditions that cause a fluid loss that are not blood related, you could have extensive burning, refractory gastroenteritis, excessive vomiting, and diarrhea because you're getting rid of a lot of fluid all at once, or over time, even with vomiting and diarrhea. So distributive shock, it results from excessive vasodilation and the impaired distribution of blood flow. There are 3 different types of this shock. There's septic shock, which is bacterial infection, and it's the most common. Anaphylactic shock, which is an allergic reaction. And neurogenic shock, which is a spinal cord injury that does damage to the nervous system. So cardiogenic shock is characterized by primarily myocardial dysfunction that renders the heart to be unable to maintain adequate cardiac output. The decreased cardiac output can lead to tissue hypoxemia or hypoxia with adequate intravascular volume. So what does that really mean? Well, this one is not an issue of you not having blood or fluid or losing excess amounts of it. You have adequate intravascular volume, but you've got myocardial dysfunction, so it's not being able to pump out the blood to reach the tissues and perfuse them and give oxygenation. So you have the blood volume, but you don't have the mechanism that's going to be able to pump it effectively to give oxygen to the rest of the body. So this is a leading cause of death in acute myocardial infarction with mortality rates as high as 70 to 90%. Obstructive shock. So that's an anatomical obstruction of the great vessels of the heart and leads to decreased venous return or excessive afterload, resulting in decreased cardiac output. This is a medical emergency and can include complications such as pulmonary edema. So here's just a short little overview just to give you a little visual of those. So on the left, distributive excessive vasodilation, you see the blood vessel there and arrows going outward, meaning that it's less constricted, so there's bigger there. So that's going to increase the systemic vascular resistance, which is going to make it harder for blood to be able to circulate as well. So that's the bigger issue there, is that you're not being able to get blood flow to go around, and impairs that because of that wider diameter. Like Poselli's law would state, like if it's smaller, there's more pressure. But the larger the vessel, the less pressure that's in there. So it increases the systemic vascular resistance, making it harder to have blood flow distribute. So, and then hypovolemic here, I'm not the biggest fan of their illustration here, because you see at the feet and knees down, you see the vessels actually perfused. But in this case, it would be, the blood would be working with the vital organs, your brain, your heart, your lungs, because in that kind of situation, your body's going to make sure that those things are being adequately perfused before your extremities, because the extremities don't keep you alive. Your heart, lungs, and brain do. Cardiogenic, so compromise of myocardial performance. You can see there at the bottom of the right atrium all that inflammation and ischemia, which is causing damage to that right atrium, which is making it harder to pump adequately, which will impair cardiac output. Obstructive, So that's the obstruction. It will obstructs filling the heart, ejecting from the great vessels, which decreases the cardiac output. And you see there, they got arrows indicating to the pulmonary artery. There's some sort of blocking there that's keeping it from being able to adequately fill and eject blood to go out systemically, which will decrease the cardiac output and decrease tissue perfusion, causing tissue hypoxia.